I have the huge pleasure today of introducing you to an extraordinary new aesthetic surgery clinic, Wood MediSpa, which is set in this arts and crafts mansion in Devon. And it's been a long-term project created by consultant plastic surgeon James McDiarmid, who over the past 13, 14 years has been restoring this house. It was derelict for like 40 years. And he has now created a centre of excellence here that encompasses everything from proper surgery for face and body through a dermatological suite with dermatological surgery as well as the normal skin consultations to non-surgical procedures and dentistry. It's all here. So we're going to go and meet James and get him to show us around and see exactly what is going on here. So James, what have we got here?
We have a state-of-the-art aesthetic surgery hospital built inside a grade 1 30-acre garden, grade 2 star arts and crafts mansion.
I mean, it's pretty phenomenal, isn't it? I mean, this is quite unique. Completely
unique.
And you have created this from a derelict shell?
Yeah, a derelict shell, a building that was a happy family home until Death Duties forced its sale. Built in 1904, Death Duties forced its sale, became a hotel for 20 years and then neglected thereafter. And we've had to do everything.
You've got a whole team of super specialised consultant plastic surgeons working with you, consultant dermatologists, you've got a dental clinic.
I just think these specialties work well together. There's lots of commonality and cross-fertilisation between our specialties.
Okay. You've got 30 acres?
30 acres, yeah.
And you're right on the edge of Dartmoor?
Yeah.
But this is world-class expertise that you've got here, state-of-the-art surgical premises. People can come here for anything from injectable fillers to dental work to a deep plane facelift or body recontouring. They can stay overnight, they can stay a bit longer if they need to.
Hotel stay coming next year.
Okay, but I mean, that's really unusual.
Yeah, and we looked at various other models for this. We did our due diligence and went abroad and viewed other excellent places, and really that's where we wanted to position ourselves.
So how many of you are there here on the premises?
There are 5 plastic surgeons who aren't all here at the same time.
Right.
We have a maxillofacial surgeon as well.
Okay.
We have a dermatologist, 3 anaesthetists that share out the anaesthetic work, and several dentists. It's the jumbo jet analogy. The pilot, the co-pilot, all of the crew, if they're working together every day, you're going to have a smooth flight.
Yeah. Okay, see now we're at the operating theatre. I mean, this is the heart of the whole thing, isn't it?
This is the centre of everything here.
Yeah.
So we have a state-of-the-art operating theatre, 25 air changes an hour, which is absolute gold standard. We have everything in here that we need for safe general anaesthesia. Everything is electronic. All the patient records are electronic, and we have a hospital management system which takes care of everything.
In here, it's surgery for
face, body, and breast.
Yeah, and hands too.
Yeah, we do a little bit of reconstructive work as well. That's what our backgrounds are in the health service. It's a fully fledged CQC registered hospital.
Yeah.
This is our recovery, fully equipped with gases, suction, nurse call alarm system, and patients go from here up to the ward in the lift.
Very nice hospital room with a logo dressing gown.
Yeah.
And how many of these rooms have you got?
We've got 5 rooms.
Okay. With everything you need?
All the paraphernalia, nurse call system, suction and oxygen.
And the doctor on site?
Yes.
Yeah.
We have an RMO, a resident medical officer, on site all the time while there are patients in.
Okay. So people can come here and have something pretty invasive done and then stay for a day or two?
Yeah, so the maximum stay we have is 2 nights.
Another part of the house that isn't finished yet, you're going to be developing into hotel rooms?
Exactly, because what people tend to do after they've had surgery is go home and worry.
Yeah.
Is this a wound infection? Does this look right? Is this normal? And so rather than worrying at home, people can recover under the same roof as the surgical team.
Sure. Spa, stay, hospital, surgery, vacation, all in one.
In a beautiful Grade 1 listed 30-acre estate in Devon.
Lovely. What do you do up here alongside normal dermatology?
Yes, so as a consultant dermatologist, I see everything from hair loss in men and women, acne,
Sure.
a lot of skin cancer and pre-cancerous skin changes, as well as people with sunspots that they want to have treated and removed that aren't available in the NHS.
Yeah. And you're a dermatological surgeon as well, aren't you?
Correct, yeah. So I'm what's called a Mohs micrographic surgeon.
Sure.
So Mohs was a gentleman, Frederick Mohs, was an American general surgeon who described the technique a long time ago now, actually in the 1930s. It's evolved somewhat since then, and that is the gold standard technique to remove a skin cancer, typically from the central face.
Okay.
And it's done while the patient's awake under local anaesthetic. And the advantage of it over conventional surgery is it allows myself to examine the entire margin of that piece of skin and ensure that I've removed it in its entirety.
So you can do that right here?
We can do all of that here now, yeah. We've built a dedicated lab.
Oh, that's quite rare, isn't it, to have a lab on
So
site?
you'd find them in your hospitals, but it's unusual to find it in a private clinic. We're very fortunate here that we've been able to establish the only private Mohs service in the southwest.
And all done with the most insane view.
And all done with the best view ever. This is I have the best view of any dermatologist in the world, overlooking
nice.
the croquet lawn. Indeed, yeah. So that's where I get my lunchtime break.
So this is your laser room, and I mean, you've got a huge expertise in laser over the years, haven't you?
I've been using lasers for 25 years, yeah.
Okay, CO2 lasers.
CO2 for resurfacing, fractional and ablative, yeah, but also ND-YAG for pigmented and vascular lesions, and also lots of IPL for hair removal, mainly, yeah.
And now you've got a new laser here, which is the Jewel from Cyton. What's made you choose this one?
Lots of things, really. This is next generation. So the technology that we're currently using is good, but this is next level.
Okay.
The pedigree of this machine, it's the original CO2 laser that I started my practice with is called an ultrapulse.
Yes.
It was made by Coherent, and it was the gold standard 25 years ago.
Wow.
The person who was behind that is the physicist behind that is also behind Cyton now.
Okay.
And so the technology has moved forward, as technology always does.
Yeah.
And I think this delivers a better, safer experience for the patient.
Okay, because you've got the BBL, which is like the sort of high dose IPL on here, and then you've got the fractional as well. I mean, you can do a lot for your patients with that, can't you?
We can cover most cosmetic, or almost all cosmetic applications with this platform. This is Jeanette, who runs our dental suite.
Hi, Jeanette. Scanning with the iTero, that's amazing.
It's a way of mapping the dentition. You can adjust the scan to give people an idea of the outcome that they can expect.
Wow.
So we're doing a lot of dental implant work here, and also bracing with the Invisalign system. This is a cone beam CT scanner, which is an ultra low dose way of capturing three-dimensional images of the skeleton of the head and neck. Our dental team use it primarily for planning tooth implants and dental reconstructions, but we also use it a lot for mandibular implants and facial reconstructions. We can make customized implants like this 3D printed mandible, and we can then decide which implant will fit best, or even make custom implants for the front of the mandible to increase its length, to make it vertically taller, or to enhance the mandibular angles.
You must feel quite proud.
Really proud, and I have kind of pinched myself that it's actually happened after all this time.
After all that you've been through, yeah.